When we come to make a diagnosis of psoriatic arthritis, there are things that we can see on exam and that are easy to find, and there are things that we can't see. Examples of things that we would look for on exam to help with diagnosis would be the skin rash, which can be very obvious, but can be in difficult places to find, and the patient may not be aware that it's there. So we may look behind the ear, at the base of the scalp, and in the hair. And we may look also for nail changes, which may be very discreet, but may be an indication that this is psoriasis. Obviously, we still look at the joints and whether any of them are inflamed, tenderness, dactylitis, so the whole finger being swollen, and sometimes the tendons will be inflamed as well, and that we can see on exam. Things that might be more difficult to diagnose because we can't see them is whether the patient is feeling fatigued, and often patients will say, I used to be very active, and with the onset of feeling unwell, I've just had no energy to do the activities that I used to do. And that's a big change and might reflect to us that there's a lot of inflammation and arthritis going on, which is not normal for this person, but is also a good indication that something inflammatory is happening and helps us with the diagnosis.